Before I start talking about the video, I want to show you guys my brain hat, and I decided to color it and make some annotations. As you can see in there, take some notes. As you can see in here, I did the temporal bone, and I decided to separate the areas with highlighter so it was a little bit clear when I talk about the video and explain the deficits that Tom had. This was a really fun project to do. But as you can see, this is my brain. In the case of Tom, the stroke damaged the left side of the motor cortex. Therefore, Tom has trouble lifting the right arm. Hemiplegia could also affect the trunk, for which Tom may present balance issues due to weaknesses in the core muscles of the affected side. Shoulder subluxation is a common effect after a stroke, and it's referred as the upper arm humerus dropping out of the shoulder socket. Since the muscles are too weak to hold the bone in place, or they may be too spastic, which it can cause subluxation by pulling the bone out of an abnormal position. After some research, the therapy intervention I want to share with you guys is the mirror therapy. After reading multiple articles about it, it seems that it has gained attention as a rehab strategy to address the patient's arm and hand function and to recover motor function after a stroke. During mirror therapy, the patient is instructed to watch the reflection of movements of the unaffected arm in a mirror, and it creates the illusion that the affected arm is the one that is doing the complete movements. This way, it provides a visual and proprioceptive feedback of the intact arm, which it may help the patients recover faster. But what I could gather on the internet, there's a lot of strategies to use the mirror therapy as an effective technique to work with patients who suffer a stroke. Some of the most common ones was using a smart mirror, which I will upload the picture so you guys can see more or less what it looks like and how it works, and I'll also leave you a link to a pretty good video that explains it. But basically, the smart mirror, it's like a triangle with a mirror on this side, and then the patient will place the unaffected hand outside facing the mirror, and then the affected hand inside the triangle, which will stay like this and they will not see it. As the patient moves or completes any kind of a stretching, finger stretches, or pumping, fist pumping exercises, the patient will only face the mirror, therefore they'll see the mirror unaffected arm doing movement. Meanwhile, the affected hand is still inside the triangle, so they cannot see it, which will create kind of like an illusion, and the patient will think, that's the idea, that the patient will think that the affected arm is completing all those movements, which ideally it will help the patient increase the range of motion and the voluntary movement on the affected hand. As you can see in the picture, the patient will have the affected hand inside and the unaffected one outside facing the mirror.